Hey guys, this is your pharmacist Sidra and you are watching Ask Your Pharmacist, and welcome to another lesson of Pharmacy Technician's Study Guide. Okay, so if you are studying to become a pharmacy technician, it is super important that you familiarize yourself with all the terminologies and all those medical terms and words that you will be coming across on daily basis in the pharmacy. There are so many of them, I cannot really include them all in one video, so I decided I will try my best to include most of them, or let's say most commonly used ones, okay? So just to make it easy, I'm gonna categorize them alphabetically. Just to make it simple, I'm not like ranking them based on their importance. They're pretty much all important. You have to know all of them, because if you don't, then you won't be able to communicate in pharmacy, okay? Let's start with our A's. So the first one I have over here is absorption. In pharmacy or in a healthcare setting, you hear the word absorption. That means the amount of time that is needed for a medication to get to the bloodstream. And how? When you take a medication, it goes through the intestine and then it gets absorbed in the bloodstream. That's the oral absorption. Now, we don't use medications orally always, right? We use them rectally, vaginally. We use them in the IV form, in the intramuscular form. So basically, in general, whenever you see the word absorption, that means the amount of time that's needed for a particular medication given through any route doesn't matter. But what matters is how much time does that medication take to get absorbed or get to the bloodstream, okay? All right, so the next one is active ingredient, very commonly used one. Now, active ingredient basically is any ingredient that's the main component of the medication, and the main component as in chemically main component that's going to provide a therapeutic effect of that particular medication, okay? All right, so next up is number 3 is antiemetic. So in medical terms, emesis means anything related to nausea, vomiting, and anti means anything that stops it. So this anti word is something that you're gonna come across all the time in pharmacy or in medical terms. Anti means basically anything that's opposed to whatever the next word is, or whatever the suffix is in that sense. Antiemetic means anything that stops nausea, vomiting, right? Now, similarly, if you come across the word antibiotic, antibiotic means bacteria. So any antibiotic is anything that stops or kills bacteria. Similarly, antidepressants, anticonvulsants, anti-anxiety. So all of these medications or terms, they mean they are stopping that particular situation or stopping that particular element, which is in the suffix of that word, okay? Okay, so the next word is additive. Additive basically is something that you're gonna use mostly in the hospital setting. So in the hospital setting, you do a lot of like IV preparations, and additive is a substance that basically you add in the IV mixture bag. And mostly this additive is like in a solution form, in a liquid form, okay? So any liquid that you add in an IV mixture bag is an additive. Simple, right? A lot of these I think are pretty much self-explanatory, but if you kind of get the idea, the logic behind it, then you will be able to understand the similar terminologies. So the main idea behind this video is to give you guys a concept, a kind of understanding. If you just try to like memorize each of them, it'll be so hard for you to remember each and everything. So I highly encourage that you kind of get a concept, you kind of get the idea behind each word or behind each terminology, and then go from there, okay? All right, so at number 5, if you can see, is acute. Sorry, I couldn't see it there. Anyways, number 5 is acute. So acute is something that you will come across a lot in terms of illness or a disease. It's a short-term illness whose onset was like very sudden, very short-lived, It happened quick and it got resolved quick as well. For example, you stepped on a nail and now you have an open wound. Now that's an acute infection. It's not something that you had for long term. Now, if you had something for long term, that would be considered as chronic. For example, if somebody has diabetes for many years now, then we can say that diabetes is their chronic disease or chronic illness. Okay, so something that you have for long term, long duration is chronic. Something that's instant onset and is a short-lived, short duration is acute. All right, so the next one on number 6 is analgesic. Analgesic basically refers to anything that helps relieve pain. For instance, your Tylenol, your ibuprofen, your Aleve, all these over-the-counter medications that are used to relieve any sort of chronic or acute pain are referred to as analgesics. Okay? Number 7 is antacid. If you can see, it's funny how on my whiteboard you can literally see the reflection of my ring light. Well, now you guys know I use a ring light. That's why I am always very bright on the screen. I did not wake up like that. Just an FYI. Anyways, so number 7 is antacid. Antacid is also a very commonly used term. This is basically anything that's used to help relieve acidity, like your Tums, your Rolaids. So antidote is basically any agent that counteracts the poisoning. Or to be very particular, we can say any agent that counters the poisoning effect of any other agent. Any other agent meaning any other poisoning agent. So antidote is an anti-poisoning agent. Anticoagulant means any medication or any agent that basically stops the clotting, meaning we are referring to the blood thinners here, like your Plavix, like warfarin, Coumadin. All right, so the last one is the antihistamine, a very, very commonly used term. So antihistamines basically refers to any medications that stops the histamines, and histamines are the agents which cause allergies like runny nose, runny eyes, not runny eyes, watery eyes, runny nose. So all these effects are basically caused by the histamines in our bloodstream, and we take antihistamines like Benadryl, Claritin to actually stop the action of the histamines. Thus, if somebody has runny eyes, oh my gosh, I keep saying runny eyes. So anyways, if anybody has like watery eyes, runny nose, then you will see pharmacists recommend antihistamine all the time. So that's a very commonly used term. Okay. All right. So the next up we have is a binding agent. Binding agent is basically anything that holds together the ingredients of the tablet. Mainly, I would say anything that holds together the active ingredient of the tablet is a binding agent. Okay. Then is the brand name. Brand name basically refers to the proprietary name or a name that a certain company gives to a medication. All right, so next is the buccal tablet. Buccal tablet is basically any tablet that we place in the cheeks, and it's like a dissolving tablet because the lining of the cheeks have these blood vessels which help in the absorption of any medication faster. So just like your sublingual tablets, which is another good terminology to remember. So sublingual is anything that you place under the tongue. Lingual means tongue. So anything that you place under the tongue is sublingual, and buccal is anything that you place within your buccal cavity, which is your cheeks. All right, so the next is bioequivalence. Bioequivalence is a very important term, and I'm going to split it for you so it's easy for you to remember, because then it's going to make more sense. Okay, bio means body or life, and equivalence means equal. So bioequivalence, anything when taken within our body has the same effect as another medication, could be of a different strength, different type, but has the same effect as of medication 1 is the bioequivalent. So if medication A, if a drug A when given to our body helps relieve the migraine, right? And then you give another medication B which also has the same effect in relieving the migraine, then that means the medication B is a bioequivalent of medication A. It is equal in effect within the body, okay? All right, so the next is chemotherapy, any therapy or treatment that is used in the treatment of cancer. Next is a compound. Two or more substances combined together makes a compound. Easy peasy, right? All right, so next up is contagious. This term refers to the time period in which an infectious person can basically transmit disease to a healthy individual, okay? That could be either via direct contact, indirect contact, or through airborne particles, whatever that route of transmission is. Next up is decongestion, very commonly used term in pharmacy. Decongestion is basically anything that helps in congestion, like your Sudafeds, your nasal decongestion. So anything that basically opens up that mucous membrane in your airways, in your nasal cavity, that would be simply called a decongestion. Next up is diuretic. Diuretic means anything that eliminates excess fluid out of the body, like your Lasix. That's a prescription medication. Among your over-the-counters would be Midol that contains a diuretic. That means it helps in the elimination of excess water out of the body through urination. So diuretic is basically any substance that increases the flow of water in your kidneys and releases it through urination. Basically what it does is it kind of stops the retention of water in the body. Diuretics are actually very commonly prescribed in people who have edema or who have like a congested heart failure, and these are the people in which excessive fluid retention can result in heart problems. All right, so effervescent tablets. Effervescent tablets are basically the tablets that we dissolve in a liquid before taking them. Emulsion is also a very commonly used term. Emulsion basically refers to any two liquids which normally wouldn't combine, but using an emulsifier agent, we combine them together. So emulsion is basically two liquids combined together. And I want to talk about suspension here, in which a solid is suspended in a liquid, which normally it wouldn't. So using a suspending agent, we suspend a solid in a liquid and thus forming a suspension. So the main difference between emulsion and suspension is emulsion is two liquids mixed together and suspension is a solid and liquid mixed together. And a fun fact here, a very commonly used natural emulsion is milk. Expectorant is another very commonly used term. It's anything that helps remove the mucus out of your chest. It's similar to decongestion, but decongestion basically refers to the mucous membrane of your nose, and expectorant basically loosens or releases the mucus from the mucous membrane of your respiratory tract. Next very commonly used term in pharmacy is generic name. Just like brand is your proprietary name given by the manufacturer, generic name is the chemical name or the active ingredient of the product. Basically, it's a non-proprietary name. Oh, another good term is half-life. Half-life is basically the amount of time in which half of the substance is broken down in the body, or we can say half of the substance or medication is absorbed within the body. Another commonly used term is immediate release and extended release. Now, these are very commonly used terms associated with the medications. Any medication which is immediate release means it's gonna be short-lived, it's gonna show its effect in the body quickly, it's gonna be quick in and quick out, okay? Like quickly absorbed and quickly eliminated out of the body, okay? And the extended release, however, is something that's designed in a way that it's slowly released within the body over a period of 12 to 24 hours. Next up is immunosuppressant. Immunosuppressant is any agent that basically decreases or suppresses your immunity. For example, your steroids. Next up is intradermal and subcutaneous. They're both pretty much similar. So anything that we administer under the skin is subcutaneous or intradermal. Like for example, your insulin injections that we inject under the skin, and normally these injections are administered in the abdomen area, behind your arm, also on your thighs. Those are some common sites of subcutaneous injections. And similarly, there is an intramuscular, so anything that's given through your muscle is intramuscular. For example, your vaccines, which are commonly administered in your arm. And just an FYI, there are 4 intramuscular sites on your both arms, one up here, one kind of a little bit down here, and similarly one up here, one down there. Next, very commonly used terminology is laxative. Laxative is anything that helps with constipation or anything that increases defecation. Legend drug is something that you will hear very commonly in pharmacy, and that's any drug or medication that requires a prescription is a legend drug. Next up is narcotics. Narcotics are basically pain relievers and they have a high abuse potential. These are not your regular pain relievers like your Motrin or Aleve and Tylenol. These are your pain relievers like opioids kind, like Norco, OxyContin, things like that, which have an abuse or dependency potential. Next we have is nausea. Of course, very commonly used term. Everybody knows it. Nausea refers to vomiting, okay? In hospital setting, you will come across the word parenteral very commonly. So any medication that's administered in the body other than the oral route and mainly via injection. So it could be an IV, like intravenous or intramuscular, intradermal, anything like that. Next up is placebo. That's something you want to familiarize with. It's any medication. Placebo is basically a dummy pill. It's very commonly available in your contraceptives. Any medication which does not has an active ingredient is a placebo pill. For example, in case of contraceptives, they have those 7 pills which don't have active ingredient, but sometimes they do have other ingredients like iron. Iron here basically is not an active ingredient because in contraceptive, your active ingredient is hormone, right? You're not taking contraceptive to get iron. If you want iron supplement, you can just buy regular iron pills over the counter. You don't have to get a contraceptive, right? You use contraceptive to get a hormone replacement. So the hormone in the contraceptive is active ingredient, and the placebo pills are the ones which do not contain hormone, rather they have nothing. They are like sugar tablets or they have iron supplement in it. Okay, lastly, I want to discuss the term scheduled drugs or controlled drugs in pharmacy. I think I have talked about it in my other video, I think in lesson 3, where I talk about the pharmacy laws, but I want to talk about it here in this video as well. So scheduled drugs are your scheduled 1 through 5, or they're controlled drugs from 1 to 5. Scheduled drugs or controlled drugs, one and the same thing, no difference. Now, scheduled drugs are basically classified controlled drugs, and they're controlled by Drug Enforcement Agency because these drugs have a high abuse potential. Now, they're classified as Schedule 1, 2, 3, 4, 5 based on their abuse potential, meaning the Schedule 1 drugs have the highest abuse potential. Then the second highest abuse potential would be Schedule 2, and then it kind of decreases as we continue to Schedule 5 drugs. So again, Schedule 1 are your drugs which have highest abuse potential, and Schedule 5 are the drugs which have the lowest abuse potential within your scheduled drugs. And just so you get a clear picture, Schedule 1 are basically the medications which are used just in the research industry. They're very raw, like your marijuana, weed, things like that. They're not prescribed as a prescription in pharmacy, thankfully. Schedule 2 are mainly your opioids or narcotics, basically your pain relievers or your amphetamines, Adderall, Vyvanse, things like that. Schedule 3 are basically also kind of your pain relievers like Tylenol with codeine, or your anti-anxiety medications, or your sedatives and barbiturates. And then Schedule 4 are your anti-anxiety medications like Ativan, Valium, Zolpidem, things like that. And Schedule 5 includes, for example, Lyrica. Okay, I know I said that was the last terminology, but I really wanted to talk about one more terminology, and that is withdrawal symptoms. Since we were talking about the controlled medications, I thought I might as well talk about withdrawal symptoms. So basically, a withdrawal symptom is any effect that occurs after suddenly stopping a medication which has a highly addictive property. So if somebody is using the controlled medications, which like I said before, have a highly abuse and addiction potential, if somebody is using them for a long term and suddenly they stop it, they're gonna have a withdrawal symptom, which means that now their body is like so depending on the medication and the body is like literally craving for it. All right, so there you have it. Those are my top picks in the commonly used terminologies. I hope you guys did understand the concept behind them. You're not just gonna try to memorize everything, try to grasp the concept, and I know you'll be okay. And like always, if you guys have any questions, leave them in the comments, or you can simply DM me or send me an email at this address. We'll see you guys next time. Bye.